Video on this COVID-19 series, coming up with a new topic, green fungus infection said to have occurred to a person of Madhya Pradesh, Indore. Very recently we have come across one after the other the various fungal infections that have taken away lives of people, and people who have recovered from COVID. The second attack of COVID has shown us a ever new thing in front of us, that is the various fungal infection. First it was the black, then came the white fungus, later on yellow, and now green fungus. A patient who has said to have contracted black fungus, on test it was shown that it is aspergillosis, that is aspergillus, the green fungus which has patient has contracted. He has said to have got infections in his lungs, sinuses and in blood. So all these things will be covered in this video. What are the fungal infections? Why these have taken lives? Look, a COVID-19 attack could have saved lives, but a fungal infection taking away lives is a very big news. Why such infections have occurred to people who have survived, who have recovered from COVID? What are the symptoms? What are the treatment? And what sort of precautions we need to take for those people who have recovered from this disease? Coming up with this video, so please stay tuned and please stay till the end of the video so that I can cover all the topics. So viewers, we are continuing with the discussion on this black fungus, yellow fungus, green fungus, white fungus, the various fungal infections. Look, a fungal infection, first of all, let me give you a sign of relief first, that it is not a contagious one. It cannot cause high infectious rate, but it has caused a high fatality rate, a mortality rate which is very high. People or patients who have recovered from COVID-19 need to have a proper COVID appropriate behavior. That is, the causes of this fungal infection. Look here, when I am speaking in front of you, bacteria, virus, fungus, it's all present around us. But then why a person, so long we have been so much exposed to these spores also, we have inhaled some of the spores, but we have not been attacked with such fungal infection that has caused such serious cases where there is a blackish lesion. Second wave, what we have seen, the fungal infections, I have written it on the board. You can see the diagrammatic figure also. This video is based on the present situation, the scenario that we are facing. So if you really want to know about the fungal infection, please stay with me till the end. And this video I have not composed or not going to script it only for the people who knows biology. No, it's for the general awareness for all others who should be very careful even after COVID. So the fungus, the structure is, first of all, it's the family of the black fungus is Mucor Mycosis, which we know the other name is Mucor Mycosis. The structure is somewhat like this, a bulbous structure. You can see this is the spore sac, which is known as the sporangium. Here the spores are located. Here it's the cells of columella. These cells get released, and due to the spore sac burst open, releasing the spores, these spores are released and they are inhaled or they get attached to the body tissues, and their entrance route could be a cut or a scrape or a burn in the body, and then they cause the damage, that is the fungal infection. This is the stem part of it, that is the sporangiophore. This is the brief structure of this knowledge. What we need to know is that why such things have happened. Look, in a patient who has been attacked by coronavirus, to combat the infection, there has been use of antibiotics, there has been use of steroids. Steroids are organic compounds. These are acting just like the hormones. Hormones are naturally secreted, means these hormones are secretions of the endocrine glands. A biology student will be understanding this. Otherwise, for a normal person, for an ordinary person who doesn't belong to this field, for that person I would say hormones are just the secretions of some of the endocrine glands, which are ductless glands, and these secretions are naturally prepared by the body. Now, what happens is a COVID patient, in case of COVID patient, what has happened? Due to infection, the rate of infection, the use of steroids have been higher. Means the steroids which have acted just like the hormones. Steroids are prepared by man, that is artificial. It's not natural, prepared by the body. It's artificially prepared. The use of steroid, where it has to be 5 to 10 days, maybe a prolonged period of steroids have been used to that patient. Use of antibiotics have been there, and due to this overdosage of antibiotics, of the steroids, there has been already the blood glucose level has gone higher, because it has triggered the blood glucose level. So when a blood glucose level goes higher, these fungal spores can have a good, means it can invade the body tissues. Due to several causes, the summarizing points, it could be high blood glucose level, upper age, lack of immunity. Definitely the lack of immunity has taken place due to coronavirus infection. That lack of immunity has yielded the process of this fungal infection. The fungal spores, this is the spore sac, these spores have got released. They have been in air, they are present around us. You must have watched tomatoes or bread catching up fungus. If you keep it outside for a few days in this humid climate, right now India it's the end of summers, rains have started, it's very humid, hot, humid climate. A fungal spore means it can cause, it becomes vegetative first of all. It starts its growth, that is, it goes on to the stage of vegetative growth, and then it multiplies in number and causes invasion to the blood tissues and body tissues. And this has happened, all this has happened due to the reason of high humidity, due to the reason of prolonged stay in ICU, due to the reason of use and overdosage of antibiotics and steroids to combat the infection of coronavirus. This has been used. Now all this have created the atmosphere for the fungal infection to take place. So a COVID patient needs to take, even after recovery of COVID, needs to take few precautions. Prevention is always better than cure. So the patient who has survived COVID must take appropriate behavior. That is, the masks that are worn, it has to be clean. The hands must be clean. In fact, the whole of the environment must be very spacious, airy. Avoid using coolers too much, because it will create a humidity again. In offices, in rooms, it should be airy. Another point that has to be kept in mind is, please check on the blood glucose level. It should not be higher. As soon as the blood glucose level goes higher, there is a risk. First, go on with the explanation of this fungus, the black fungus, that is Mucor Mycosis, which is also called zygomycosis. And Mucor Mycosis or zygomycosis, mycosis is the term that is used, and this fungus, black fungus, it's actually fungus is present. We are very prone to these things very easily. A healthy person cannot be infected by a fungal infection so soon. The reason is immunity power is strong enough to fight it. But what happens for Mucor Mycosis or for any other fungus that is green, white and yellow? What happens is that these spores get released, they invade the body tissues, they look for a route. That route could be, that entrance route, maybe a cut in the skin, maybe an injury, maybe a scrape, maybe a burn, and hot, humid climate. This has all created the atmosphere for the fungal spores to get released and enter into human body. After entrance into the human body, it has attacked the body tissues, it has invaded, it has stopped, it has prevented the normal blood flow. And thus, you will be finding the patients who have got black fungus, that is Mucor Mycosis. The symptoms, the signs are some black patches, maybe around the sinuses, maybe upper jaw you will find some black spots. Those are because the blood flow has stopped. The fungal spores have invaded the body tissues, they have stopped the normal blood flow, and thus a black region around the eyes, even one side of the face has become swollen, one side, and it has turned black. It's very hard to look at those pictures, but these are some of the signs and symptoms. And there has been such an attack, even people have lost their vision, power of vision. So fungal infections, Avoid taking food which is left out in the open air for a long time, because it's very natural for the fungus to take its growth over there, for its vegetative growth. As I said, the fungal spores go into the vegetative stage, that is growth stage. They multiply in this number, these spores get released from here, and the moment it gets released, it tries to invade the body tissues. So avoid taking food that is left in the open air. Avoid humidity, avoid the rooms which are suffocating, avoid uncleanliness, avoid overuse. The black fungus, where does it thrive? Where does it grow? Usually it looks for decaying leaves. Even the food left in the open air, you will be finding not only black, you will find even green, yellow also, different coloration. So these terms, black, white, yellow, and now green fungus reported in Madhya Pradesh. A patient has got, that is aspergillosis. This is Candida albicans. Sorry, white is Candida albicans, and yellow it's only due to leakage of the pus. Black, that is Mucor Mycosis or Zygomycosis. It's the family of fungus, molds you can say, which commonly grows in decaying leaves, in organic matter, in wetty vegetation, or maybe even the tomatoes you must have seen, and the bread left in the open air, you will find a lot of colors coming up, and there is something that is spoiling that. So this is the basic idea, that where you will get to see the fungal spores are present in the air, we inhale it, but it doesn't cause any damage because we have a good immune system. As the COVID patients have lack of immunity, these spores have attacked them. They have damaged the body tissues and such colorations. It depends on which organ it attacks. What are the types of black fungus, that is Mucor Mycosis. You can say on which organ it is targeting. Rhinocerebral, this is the orbital region it is attacking. Nasal passage, the sinuses, the brain, it attacks in. See, look, the sinus region, we must have come across this term used by the doctors, that is the sinuses, the frontal lobe here in the forehead region. There is sinus frontal, here in the cheekbones, that is the maxillary, around the bridge of the nose, near the eyes, the ethmoid sinuses. So these are the terms that are used, but overall these have attacked the brain also. It has, the symptoms could be a high fever coming back again and again, weakness, fatigue, all due to the rhinocerebral. And in this case, the dark patches that we get to see in a patient in the upper jaw also, in the upper jaw or in the one side of the face gets swollen, and there is some blackish thing developing, lesion is developing. Mucor Mycosis, that's the term that is used. Rhinocerebral orbital also it's used. Rhinocerebral Mucor Mycosis. We come to the pulmonary Mucor Mycosis. Pulmonary Mucor Mycosis, the term pulmonary means lungs. This video is basically not only about the biology students, so I am trying to make it easy for you. Pulmonary, it's about the lungs. Naturally, if it is infecting the lungs, if such infection, breathing problem, suffocation, chest pain, fever, weakness and fatigue is throughout. Means in all patients who are suffering from this fungal infection, it has been seen weight loss has taken place, they have become very weak and other problems have arisen. So pulmonary means lungs. Another is cutaneous Mucor Mycosis. Cutaneous means skin. If it is infecting the skin, see, on skin what happens, the burning sensation, it causes skin decay. So a wound also. So this is due to the cutaneous Mucor Mycosis. And lastly, disseminated, which is quite a serious one because it's all in the bloodstream and very difficult to be treated, because it all happens due to the transplant, organ transplant. When a person goes through an organ transplant where maybe the kidney or or the liver, a region has been transplanted to his body, the body tissues must be able to take that new organ, and during this taking or adoption of this new organ, the body tissues have been invaded. As I have used the word invaded, invasion of the body tissues have taken place by these fungal spores. They have invaded, they have prevented the normal blood supply into the bloodstream, and thus this coloration. These terms of colors are nothing but the same family of molds of fungus, only it depends on which organ it is attacking and what sort of activity it is causing. So this is a brief idea about the types of black funguses that it is caused and what sources of this black fungus, that is Mucor Mycosis or zygomycosis, the treatment process. Before I talk about it, a CT scan is required, but you know, sometimes it happens, often enough it happens, the picture obtained in CT scan shows that image, which is quite relevant for a COVID patient also. So whether the person has contaminated or have contracted a fungal infection or have got COVID-19, that test only by the help of RT-PCR method it can be ascertained. That is also means quite a confusing matter. So as far as the treatment process, sample or swab can be collected, and then examination under microscope can reveal the fact whether the fungus infection has taken place, what fungal infection has taken place, and how it can be dealt with. There are various fungal antifungal drugs are there which are prescribed by doctors. You can get it all, means the doctors have prescribed them, so you can get it all from them. And overall the precautions or the measures that one needs to take even after COVID recovery, that is a COVID appropriate behavior. One has to avoid humid climate, humidity in open space, means there should be open space in humidity in the rooms. Avoid using coolers too much because it creates a lot of humid air around, and prolonged period of use of steroids have yielded this, as I have discussed. Steroids for 5 to 10 days it should be, but to combat the infection, prolonged period of use of steroids and antibiotics has given us this consequence, that is fungal infections taking away lives. Overall uncontrolled diabetes, the blood glucose level has gone higher. So these are the various aspects one needs to be taken care of during fungal infection. Always a prevention should be taken earlier. Avoid doing this as soon as the blood glucose level goes higher. Please go and get a checkup, because this fungal infection should be dealt with very rapidly. It can cause a serious damage. Even lack of vision, lack of some organs also can take place, because we have to cut off those areas. Fungus which has taken away some lives, that is the white fungus. Look, the terms that are used: black fungus, Mucor Mycosis, white fungus, that is the genus of yeast. For biology students I'm mentioning this, that is genus of yeast, that we prepare it in labs on agar plate. You will find it whitish, creamy whitish colored patches which are developing. This is the white fungus, that is Candida albicans. In labs it is prepared. In human beings also it is found in regions of your body, that is kidney, brain, skin, nails, throat region. The people who have been infected, they have shown symptoms like this, that there has been some white patches inside his mouth on the throat region, like a feeling of cotton wool as if inside the mouth. Naturally the person who is infected by this fungus, white fungus, loses the sensation of taste, faces problem in swallowing, chewing food. From throat it travels deep into the region of esophagus, that is the food pipe, then it enters the stomach, it affects the kidneys, it can affect brain also. So these are the various regions. When it affects brain, the nerves, then it is a severe headache. The person is having severe headache at that time because it has affected brain. So these are some of the symptoms that I have thought of that could be a person for a person who is having white fungal infection. There are various antifungal medicines that are there. Amphotericin B is recently being used. There are fluconazole is also there. Voriconazole is also there. There are names, various names of these medicines you can come across prescribed by doctors, definitely doctor's prescription. But overall treatment, the process of examination is a swab collected from the person's body, if it is possible. If it is in esophagus, naturally endoscope has to be done. Otherwise swab collection, then under microscope it can be tested and seen. The picture that we obtain for a COVID patient, the CT scan that is obtaining the picture, is same picture or similar picture is even seen in case of this patient, because the picture is same or similar rather, then there is a problem in examination. Then what is the cause? Is it due to the fungal infection or the COVID-19? So naturally our RT-PCR is the best method of going for testing. And after that, as I have said, there are various antifungal medicines which are there available, and one can be given, but overall use of steroids must be controlled. Uncontrolled diabetes has to be brought under control. Usage of antibiotics, prolonged use have created this, so we need to stop on those areas. And cleanliness, a proper cleanliness, a proper hygiene habit must be maintained. Avoid spaces which are very suffocating, avoid rooms which are suffocating, avoid use of too much of coolers, as the vent is creating humidity. So avoid all these things, and naturally you can prevent this fungal infection from taking away. Again another color, yellow. And last is the recent report that has been there for Madhya Pradesh, Indore patient who has been tested and have found to have contracted the green fungus, that is aspergillus. See, yellow color, it's not that a new fungus has emerged, nothing. It's the same family of zygomycosis or same family of molds that have emerged, and due to the changes they have brought to the skin, maybe a black color, maybe a white color, maybe yellow color, leakage of pus is there. Pus, the color of pus is yellow, so you can say it's a dog vomit slime mold, and that's why the name of yellow fungus has come. It is Mucor septicus. The region around the eyes, the sunken eyes, the eyes have shown some signs where there is a sunken region, and the pus that is coming out, whenever the pus comes out which is of yellow color, whenever there is a bacterial infection, it creates the pus, and due to the fungal growth, this has added, means it has as if it's an added thing to it, and thus this have created such severe things in us, that is the yellow fungus or Mucor septicus. The two things that I need to mention over here, it's organ failure and necrosis. Organ failure, that some organs can fail to act, that could be the cause of this fungus, a severe thing. That's why it is more fatal. Fungal infection cannot take away a person's life, but why this has happened with the COVID patients? Why COVID patients all COVID patients are not prone to fungal infection? It's only a 0.2% people who have been contacted with these fungal infections, and these have causes damage to their bodies. It is not a fear, not a cause of panic, but definitely a cause that has to be taken seriously. Precautions, preventions must be taken. So weight loss, organ failure, weight loss, lethargy. If a person is found to be lethargic, very lazy for a certain period of time, a prolonged period of time, the person. Organ failure, necrosis. This term necrosis, this is the term that we use for cell death. In severe conditions, cell death occurs. And lack of immunity. Overall, the lack of immunity takes place. Lymphocyte has a certain count. Lymphocytes have the defense mechanism which can be provided to our body that will help us to fight against those diseases. But as the count of lymphocytes have decreased, that is lymphopenia has taken place, naturally lack of immunity has taken place, and such one after the other things have happened. So overall, those things must be kept in mind, and necrosis, that is cell death, organ failure, and these are serious things to be taken care of. Overall, weight loss, the symptoms, weight loss, a person loses appetite. Weight loss is a very serious sign of such a fungal infection. Lethargy, healing of wounds. When a body tissue gets cut, we have a cut in our hand, in our fingers. Normally a certain period of time after that, the healing is taking place naturally. It stops bleeding and healing takes place naturally. So this takes a longer period of time. Look, a fungal infection is a systemic infection. It requires treatment rapidly. and it is not easily going to leave us. So with this black Mucor Mycosis, then came with the white Candida albicans, and now Mucor septicus, and then ultimately I am reaching to this point, that is the green fungus. When I am talking about green fungus, recent case of a person who has said to have contracted black fungus earlier, but reports say that he has contracted green fungus, that is aspergillosis or aspergillus. You must have, these are present all around us. Again, I am specifying the colors and nothing but depending on which organ it is attacking and what sort of coloration it is taken. So aspergillus, that is the green fungus, it's affecting the region of sinuses. As I have said, around, if it is in the forehead region, it is the frontal sinus. If it is around the cheekbones under your eyes, that is cheekbones, these are the maxillary sinuses. If it is around the bridge of the nose near the eyes region, it is ethmoid sinuses. These are sinus regions where you can see people getting infected by this green fungus. Lungs, the patient was who had been seen to have got this infection contracted in the sinus region, lungs and blood, and the patient has been dealt with. Now the question is, what are the probabilities, till now the symptoms? First of all, weight loss. Weight loss, lethargy is, I think you, if you have watched my entire video, I have talked about it earlier, that if a person is reported to have said having some lethargy, having some weight loss considerably, then please go for a checkup. And uncontrolled diabetes, blood glucose level must be maintained. So weight loss and high fever. The patients who have recovered from COVID needs to have proper COVID appropriate behavior to fight this disease and the post effects, you can say. Nose bleeding, yes, this is also a symptom that has been seen for the patient. The case has been reported to have said from Madhya Pradesh. From earlier studies, we have come across black fungus, different regions of India. In India, what happens is, now I am going to talk about why it has taken only in India such a lot. The reason is, in India, after summers, the climate has been very humid and the fungal infections are, it's loving this environment a lot, and a COVID appropriate behavior must be taken, which has not been taken for the patients who have recovered from COVID, as they have been in a period of prolonged ICU stay or prolonged oxygen support. The cylinders, the oxygen cylinder, the industrial oxygen they have inhaled has contracted them with these fungal infections. Uncontrolled diabetes, overuse or overdosage of antibiotics, antimicrobial medicines, and obviously steroid use. Where it should have been for a limited period of time, for the control of COVID, it has been a prolonged period of time. Blood glucose level has gone higher. Naturally, the fungal infections have invaded our body such a lot. So if these things are taken care of, I think we can fight these fungal infections. Was the end of my video. A video will end, but the awareness should not end. As I say, as the present COVID attack, that is the second wave of COVID-19, has shown us some serious situations we have faced due to COVID, the fungal infections that have caused severe damage to our body, taken away the body parts. Please do not be so much panicking about it, but definitely take the precautions. Preventive measures are always better. If you see somebody having a considerable weight loss, considerably the blood glucose level is going higher, lethargy, these are some of the symptoms that can happen to a COVID patient after recovery. Every COVID patient after recovery doesn't get infected with the fungal infection. It's only because of the lack of immunity this fungus is having a good grip on our body and taking away some of the sections of the body and causing death also. So naturally a good living must be maintained. Yoga is the best way to have a proper physical health and a mental health, and avoid using unclean things. For example, the masks that we wear, it must be cleaned regularly. It must be kept in proper places, and the rooms that are there in our houses, if nothing is available, open the windows. Open the windows, create an airy room so that you do not have suffocation. Avoid use of coolers, avoid use of too much of steroids, avoid the things which can cause such infections. And if you find the blood glucose level is going higher, please go for a checkup immediately, because the sooner it happens, the better it will be. You can be cured very fast. There is nothing to panic about. These cases have been there from different regions of India, from Ghaziabad, from Patna, and now from Madhya Pradesh. Green fungus, yellow, black, it's all the same family of molds, you can say, only different colorations, which organ it is targeting. So these are some of the things. With these tips, I am ending the video. Before I end, I would say one thing: stay with me, with my channel. I'm trying to make it easy for you, so that things do not complicate. The terms, all the medical terms or the biological terms are very complicated for some people, difficult to understand. So I'm trying to make things simplified. A simplified version comes for you. With this is Sonali Soma Mukherjee signing off. Be with me, support me, give me a few likes and comments. You can write to me. This video was on a request that I have made after watching all the funguses till now, whatever reported. I have come with this. This is on a request I have prepared. Thank you. Do support me.